Hi, my name is Pearce, and today I'll be giving a brief presentation on disability. What is disability? Who does it affect? And what issues to face with someone who has a disability? First of all, what is a disability? So, what is a disability? Well, the Disability Discrimination Act 1992 defines disability as total or partial loss of the person's bodily or mental functions, total or partial loss of the part of a body, the presence in the body or organisms causing disease or illness, the malfunction, malformation, or disfigurement of a part of the person's body, a disorder or malfunction that results in the person learning differently from a person without the disorder or malfunction, a disorder, illness, or disease that affects a person's thought processes, perception of reality, emotions, or judgment, all that results in disturbed behaviour, and includes a disability that presently exists, previously existed but no longer exist, may exist in the future, is imputed to a person, meaning it is thought or implied that the person has a disability but does not. There are many different kinds of disability, and they can result from accidents, illness, or genetic disorders. A disability may affect mobility, ability to learn things, or ability to communicate easily. And some people have more than one. A disability may be visible or hidden, may be permanent or temporary, and may have minimal or substantial impact on a person's abilities. Although some people are born with disability, many people acquire a disability. For example, some people have acquired a disability through a workplace incident or a car accident, and people may develop a disability as they age. There is a stronger relationship between age and disability. As people grow older, there is a greater tendency to develop conditions which cause disability, as identified in the following table, which I will read out. So 4 years and under has a 3.4% population affected by disability Australia-wide. 65 to 69 years old has a 40% population affected by disability Australia-wide, and 90 years and over has an 88% of population affected by disability Australia-wide statistic. Who are people with disability? Disability is part of human diversity. 1 in 5 people in Australia, almost 4 million people, have a disability, and this proportion is increasing with the ageing population. People with disability purchase consumer goods, have jobs, go on holidays, access information, do all the things that people without disabilities do. The only difference is that often people with disability come up against significant barriers while trying to do things that many of us take for granted. So now I just have a short list stated on the Queensland Government's website, just from A to Z of the conditions categorised under the term disability. So we have the acute brain injury, autism spectrum disorder, cerebral palsy, deaf and blindness, developmental delay, Down syndrome, fetal alcohol spectrum disorder, Fragile X syndrome, hearing impairment, intellectual disability, multiple sclerosis, neurological impairment, physical disability, schizophrenia, spinal injury, and vision impairment. And just after this, I'll go into detail with a couple more of those disabilities that are more general, and just have a look at them in more detail, so the symptoms and what people are affected. So the first disability that I've gone to look at in more detail is spinal injury. The reason I've chose spinal injury is because it is extremely common, and people and students, teachers, peers I feel like people are more likely to have been affected by a spinal injury or know someone that's had a spinal injury, either from family or sporting or someone that you know or someone that you've come into contact with. So I just thought it would be a good one to look at, as well as it is fairly common. So how common are spinal injuries? Well, a spinal injury can happen to anyone at any time. On average, one person sustains a spinal cord injury every 4 days, about 90 people each year. More than 70% of spinal cord injuries are sustained by men. Most of these injuries happen to people under the age of 35. Spinal cord injury is permanent, but it doesn't stop people from leading full and enjoyable lives. Spinal cord injuries occur if pressure is applied to the spinal cord and or if blood and oxygen supply is cut off to the spinal cord. Spinal cord injuries can be caused by disorders such as transverse myelitis and by trauma such as damage resulting from road accidents, water and sports accidents, and falls. Australians who experienced polio in their youth can also experience a return of symptoms later in life. Symptoms of post-polio syndrome include decline in being able to perform daily basis activities, weakness, and muscle atrophy. In addition to causing the loss of the ability to work, spinal injuries affect many areas of a person's body, such as cardiovascular and respiratory systems, bladder and bowel functions, temperature, and sensory abilities. So just going through the diagnosis of a spinal injury. So the first step in diagnosing a spinal cord injury is a medical history and physical examination. A doctor will obtain a medical history by asking questions about the details surrounding the injury. It is at this point that the quicker the patient obtains treatment, the better the chances for recovery. The physical examination will include testing to see if sensation to touch is intact in the arms and legs, as well as testing muscle strength, reflexes in the arms and legs. X-rays, CT scans, or MRI scans can be conducted to give a physician better chances of diagnosing a spinal cord injury. Alright, so next up, the next disability that I'm going to look at in a bit more detail is a physical disability. A physical disability can be described as a condition that permanently prevents normal body movement or control. Physical disability may also be referred to as physical impairment. There are many possible causes of physical disability, including inherited or genetic disorders such as muscular dystrophy, conditions present at birth such as spina bifida, serious illness affecting the brain, nerves, or muscles such as meningitis. Accidents leading to spinal cord injury, accidents leading to brain injury. The impact of physical disability can be influenced by the severity of the condition or injury causing the disability, but also by a person's physical environment and the accessibility of their community. So how common is physical disability? Australian Institute of Health and Welfare statistics indicate 1 in 5 Australians have some kind of disability, but there is no common definition of physical disability, so definitive numbers are unknown. Physical disability is reported as the most common disability in children and is more common in boys than girls. Types of physical disability. There are many kinds of physical disability. Some of the most common types of physical disability include cerebral palsy, acquired brain injury, sensory impairments, and spinal cord injury. Below are some other conditions that cause physical disability. Muscular dystrophy is a genetic condition where the body's muscle fibers gradually weaken over time. Children can have different types of muscular dystrophy. Duchenne muscular dystrophy is the most common type. The first symptoms of a muscular dystrophy may appear as stumble or difficulty climbing stairs. Getting up from a sitting position can become difficult, as can pushing things such as a tricycle for children with muscular dystrophy. Spina bifida is a birth defect which occurs when the bones of the spine do not form properly around part of the baby's spinal cord. There are 3 kinds of spina bifida, ranging from mild to severe. Spina bifida oculata is the mild form of spina bifida. which is more common and may have no signs or symptoms. It usually does not cause problems or need treatment. Meningocele causes fluid from the spine to push against the skin, and in many cases there are no other symptoms. Myelomycosis often causes the nerves in the spine to be damaged, resulting in problems with walking, bladder or bowel condition, and coordination. Multiple disability refers to when a person with a physical disability or disabilities has other disabilities, such as an intellectual, visual or hearing impairment. They may have communication difficulties or other medical conditions, such as epilepsy or asthma. When a person has several different types of disability, it is common to use the phrase multiple disabilities rather than listing separate conditions. So the diagnosis of a physical disability. A diagnosis of physical disability is based on information about a person's development or observations about behaviour and physical capabilities. There are also tests for particular kinds of physical disability. For children, there may be situations where the child's paediatrician will recommend holding off on making a diagnosis of physical disability until the child. Alright, so next up we just got a few stats and facts from the Australian Network on Disability website. So over 4 million Australians have a disability. That's 1 in 5 people. 1 in 3 people either has a disability or is likely to be close to someone who has a disability. 2.1 million Australians of working age 15 to 64 years have a disability. 3.4 million, that's 15% of Australians, have a physical disability. 1 in 6 Australians are affected by hearing loss. There are approximately 30,000 deaf Australian users with total hearing loss. Vision Australia estimates there are currently 357,000 people in Australia who are blind or have low vision. Around 668 and 100,000 Australians have intellectual and or development disorders. An estimated 10% of the population has dyslexia. That's more than 2 million Australians. 45% of the population will experience mental health disorder during their lifetime. Almost 90% of disabilities aren't visible. Impacts of disability. So in a document I found in the Government of Western Australia's website, we have some of the impacts of disability. So, while the degree and the type of disability varies with individual circumstances, people with disabilities frequently report that they experience difficulty being independently mobile or being able to see, hear or communicate. As a consequence, people with disabilities face barriers in everyday activities such as hearing or understanding what is said, seeing more small print, climbing stairs or understanding signage. The impact on the life of the person concerned can be major, particularly if the individual has multiple disabilities. Often people with disabilities are able to do things most of us take for granted, such as reading and understanding public notices or newsletters, accessing websites, participating at local swimming pool or recreational centre, playing on the play equipment at the park, hearing what is said at public meeting, and shopping at local shops. The exact impact of disability on the life of an individual varies according to the number of factors, including the specific nature and severity of the disability, the person's strength, stamina, size, weight, and age, the person's ability to cope, and the physical and social and economic environment within which the person is living. Communities which are accessible and exclusive minimises the effect of the disability. So, for the prevalence of disability, again, it was found in the area of Western Australia. So the disability affects 1/3 of this Western Australian population. The Australian Bureau of Statistics estimates that 405,500 Western Australians that have reported to have a disability, 20.6% of the total population. And an estimated 246,000 100,000 Western Australians are carers for people with disabilities. That's 12.6% of the total population, again sourced by the Australian Bureau of Statistics. 1 in every 17 Western Australians aged 15 and over, which is 91,500 people, has a disability and is also a carer of a person with disabilities. Of the 500,000 Western Australians with disabilities, 115,000 people have profound or severe core activity limitation. Profound limitation refers to when a person is unable to do or is always needs help or supervision to carry out the functions of daily living. Severe limitation refers to when a person sometimes needs help or supervision with daily living routines or has difficulty understanding or being understood by a family member or friends, or can communicate more easily using non-spoken forms of communication. Most people with disabilities experience some form of limitation or restriction due to their disability. What are the future trends in disability? Well, the number of Western Australians with disabilities is increasing. The ABS, Australian Bureau of Statistics, conducts regular surveys on disability to report the extent of disability in Australia, the need for support and adequacy of support, and the contribution of informal care. The 2003 Survey of Disability, Ageing and Carers figures for prevalence of disability shown an increase since 1998 of 50,000 people in the number of Western Australians with a disability. Between 2006 and 2026, the number of people with disabilities in Western Australia is expected to increase by more than 210,000. This increase is mainly due to our ageing population. People may have a disability at any age, but the likelihood of having a disability increases as people get older. ABS data indicates that 51% of Western Australians over 60 years of age have a disability. The number of older Western Australians with disabilities will increase substantially as the baby boomers move into the age groups in which disability is more prevalent. It is expected that there will be an overall increase of 115.7% over the next 20 years. My interpretation of disabilities are known all too well, and I have a very personal opinion. I myself broke my neck when I was young, resulting in broken vertebrae, compacted vertebrae, and 6 damaged ligaments. I was placed in a halo for 3 months and a soft collar for 1 month. I was millimetres off becoming a quadriplegic, and I was lucky enough that I'm back at full function with barely any consequences. It goes to show how easy it is, and that more should be done to stop these increasing statistics. I think that more education should be taught in health and physical education in spreading awareness of the issue and the seriousness of disabilities. Going through it myself, I learned firsthand too that it is not just the person who has a disability that is affected, it's the family who are there to support and care for you. It's the doctors and nurses who devote time to you, it's time off work or recreation activities, and the cost for treatment and care and the emotional stress that causes everybody around you, not just you. Disabilities are a burden that Australia does not need, and I hope that this sort of presentation has added to your knowledge and taught you something you didn't know about the issue, so that we can work together to work on the issue and continue to educate, so that one day maybe the statistics will decrease. That is all from me. Till next time, Pearce, checking out.